Hello, everybody. It is a little after 4. Sorry we weren't able to do a live Zoom call today. My internet crashed. We had a storm here and it hit a server. And I tried to connect on my mobile hotspot and it's not working. It's not enough power to do a Zoom call, even though I practiced it. It worked just fine yesterday. So we're going to just go through the questions and that were submitted. So there's a benefit of getting your questions submitted, I guess. So sorry about that. Okay, do you think the Jackhammer amplifier and or a True Life grounding mat would be beneficial to add to my F122 Rife? We've talked about this lots and lots of times, but the Jackhammer amplifier is good for people who don't like to cuddle with their bulb. So if you can't cuddle with your bulb for whatever reason, somebody asked a question later on that we'll talk about that they think the bulb is giving them ringing in the ears and it's causing ringing in the ears, well then put the bulb under the bed with the amplifier. That will help with that. So because it does give off a noise, and if it's closer to your ears, it could bother you. Some people, for whatever reason, don't like to snuggle with their bulb. Then you can put the bulb under the bed with the amplifier. Is the grounding mat a benefit to add? Well, we have the grounding sheets in our store that you could purchase. Just make sure you put the grounding sheet on the lower half of your bed underneath your fitted sheet. So it goes between your mattress and your fitted sheet, underneath your fitted sheet. So it's but on the lower half of your bed. So it's on just your waist down. That's how you want to use the grounding sheet. Should you use a grounding mat with a bulb? No, you should only use the grounding mat with the foot mat, with the Ion Pro Wave. The website says that the Jackhammer amplifier will accelerate the output of your True Life bulbs, which is right, so it increases the amplification. But you don't need it any higher amplification if you're snuggling with the bulb. It's already going through you. You don't need it to go through you and then in through the next room. You just needed to get it in your body. So where the jackhammer shines is if it's away from your body. You do not get EMF exposure with either of those, so you don't have to worry about that. I'm taking the Aroma Clear, the Estro Clear, and the Sulfurazyme. I have had good blood tests for the last 2 years. I'm 75 years old. Recently, I read that there's some natural progesterone cream made from yams. Would this be a good thing to put on? Do you think this would be a helpful thing to do? Why or why not? So if a person has, let's say they have colon cancer. Let's say they have, brain cancer. Let's say they have a cancer any cancer that is not hormonally driven in any way or has a chance of being hormonally driven, then you're fine using progesterone cream. If you have a cancer that is hormonally driven, then you do not want to use progesterone cream because progesterone will store in the cells and will aromatize into estrogen. So you do not want to use progesterone cream if you have a hormonally driven cancer. A friend of mine, a friend of a friend, attributes his beating stage 3 colon cancer by the supplement apigenin. So what are apigenins? Do you test for this? I typically don't test for that. Apigenins are flavonoids. I think they're in oregano. There's a high amount of them in oregano. They're in onions. I think they're in broccoli. They're in a lot of your vegetables. So there are apigenins in your greens drink. If you were going to do oregano, you could use it for that. And maybe so it is a flavonoid. So remember we talk about when anybody asks questions about inflammation. I have inflammation. What should I do about that? And I always talk about, seems like almost every Zoom call we talk about the flavonoids. So your typical flavonoids that you think of are curcumin, green tea extract, boswellia, resveratrol. Those are your most powerful flavonoids. But there's a lot of different flavonoids in vegetables. That's why I like the greens drink, because it's got such a mixture of different vegetables, and it's just a whole food product. That's why you should be eating your vegetables, because they have different things in it that have a synergistic effect. Could you just take this product? Yes, you could take that product too. So, but it is in the flavonoid category, and it is highly anti-inflammatory. Quercetin, green tea extract, I said, I think already, white willow bark, and stinging nettle, all those kind of things have flavonoids in it. So they're anti-inflammatory. So using any of those flavonoids can be quite helpful for any inflammation. And with any disease process, there's inflammation, and certainly with cancer, there's inflammation. When I started the keto diet, I experienced leg cramps at night. I researched and saw that potassium supplementation might help. It seems to, although I can create leg cramps at will simply by pointing my leg toes. So obviously I don't do that normally. Okay, so when a person can kind of create a leg cramp because you're basically tightening your muscles and then they cramp up, that's typically a sign of needing minerals. So if you tighten up your leg and it goes into a cramp, or you tighten up your foot in a certain way and it goes into a cramp, um, typically that's a sign of being deficient in some minerals. So taking some minerals can help, and electrolytes like potassium can be very helpful. So yes, taking potassium can be extremely helpful. So I'm managing these leg cramps for the most part, but I wonder what you attribute them to as it relates to a ketogenic diet. It really, if you're not getting a lot of minerals in your ketogenic diet, if you're staying away from vegetables that have any kind of carbohydrates, you could be missing the vegetables that have minerals in it. Maybe that's it. I'm not sure exactly. Everybody's definition of a ketogenic diet and what they've chosen to eat on the ketogenic diet is a little different. So typically, you're not going to get minerals in any useful complex in meat products, and most ketogenic diets are high in meat products. So maybe that's what you're missing, is just minerals. You took me off turmeric and curcuclear, and I added intenzyme fortide to see if the rash would go away. So this person had a rash, and what we were trying to see is if the possibility of the rash was due to a sensitivity, or um, that the person has antibodies to turmeric. So turmeric is a food, it's a spice, right? And you can develop antibodies to turmeric. It's not really very common, but I've seen it before. So you do a Cyrex 10 panel, it measures for all sorts of different things, and one of them is turmeric. And I've seen people have positive antibodies for turmeric. They can't take turmeric, and I was just curious to see if this person's rash was due to the turmeric, so I had them go off of the turmeric to see if the rash would go away without having to spend $500+ to do a Cyrex Array 10. It says, now my rash has increased to other areas, and I'm wondering if not reacting to the enzymes. Well, see, this is called an elimination diet. You're trying to eliminate things that you think could possibly be causing a rash. You could certainly eliminate the enzyme forte. I just highly doubt that the rash is due to the enzymes. I think it's something else. If the rash didn't go away and it seemed to get worse after you went off the turmeric, then it's certainly not the turmeric. I'd go back on that for sure, because that's going to be a good anti-inflammatory. There's something else going on. There's something maybe in your diet that is causing it. You're going to have to continue to kind of look at things that maybe in your diet that could be causing the rash. There's just so many things. There's going to be another rash question coming up here. There's just so many things that could cause a rash. Usually it's a histamine type reaction, but it could be a histamine reaction from something you're breathing in, from something you're eating food-wise, from dyes, colorings, chemicals, something you're exposed to just outside in your yard. You're out, oh, I just started this rash a month ago. Well, maybe it's just because you just started getting outside in the summertime. Maybe it's from something you're spraying on your lawn. I mean, there's just, you have to kind of be an investigator to try to figure some of this stuff out. Even running some functional medicine panels might not pinpoint why the person has the rash. So, because it's something in the environment that you can't always test for. With the increased dose of the enzyme forte in the last 3 days, I've noticed a returning the rash to my neck. And it could be that. So let's eliminate that. Let's see if that's it. That could be. I kind of doubt that if that's it, but anything's possible. The neck and knee rashes itch, wondering if the enzymes could be causing the rash, as I've noticed an increase in gas with the new changes. Well, I think that's a little bit different. My primary physician wants me to go on an oral antibiotic for my left knee rash, and my wondering how this will current. Well, I don't understand why an oral antibiotic for a rash. So an antibiotic is only going to help a bacterial infection. So unless he thinks that the rash is caused from a bacterial infection, which it possibly could be, but with gut issues, I don't know if I would jump to that right away. Doing another cheek swab might be helpful too. I would go back to my first idea of making sure that you're doing some different food eliminations to see if there's anything else that you could be reacting to. And a rash question from somebody a few weeks ago too, and it's you can eat things like don't think that, oh, I've been eating this for so long. It certainly can't be that. You can develop antibodies to things that you eat a lot of, and that's one of the reasons why you can develop antibodies to things, that is because you eat a lot of them and you've eaten them for a long time. So just because you've never had a problem, quote unquote, with that thing in the past doesn't mean you won't in the future, or that might be what is currently the cause of the problem. So if you're going to try to get to the bottom of this with an elimination diet, then you got to eliminate many of these dietary things that you might be causing it as well. Is there anything on lab results that would indicate an issue? I saw a comment that mentioned anemia. This person sent in their labs, and you certainly do have some anemia, and we should probably set up a call for this person who sent in their labs. I was discussing the value of hyperbaric oxygen to a hyperbaric oxygen tank with a DO friend of mine, and the question came up: does hyperbaric oxygen increase the metabolic activity of hypermetabolic malignant cells? I haven't seen any evidence of that. So this is the difference between increasing O2 and increasing O negative. So understand chemistry a little bit. Hyperbaric oxygen increases oxygenation of tissue, increases O2, which can really help with cells. I don't think it increases metabolic activity of malignant cells. Matter of fact, there's enough studies that show that it helps with cancer. The only thing I have negative against hyperbaric oxygen is that it's you almost have to have a hyperbaric oxygen tank in your house, because you have to. All the studies that have done hyperbaric oxygen have done it on a daily basis, and it tends to be better for brain issues. Hyperbaric oxygen really shines with brain cancer and brain issues and dementia issues. That's where hyperbaric oxygen really shines. For colon cancer, for liver cancer, it's pretty iffy. And it takes time. You're doing it for at least an hour every day. So, it's not one of my favorite therapies for that thing. But if a person has brain cancer, hyperbaric oxygen would be something that would be viable to add. It does seem that the rife is causing my ears to ring. Here's that question about the ears to ring. Last night, when I turned on the rife, the tumors in my right breast stung intensely. So I think that is a very good thing. So much that I turned it off for relief. Any insights? Well, I think when you talk about good pain, bad pain, when you have tingling feeling, any type of feeling in your tumor when you turn the rife on, I see that only as a very, very, very positive thing. Ringing in your ears is another thing. That's not necessarily a positive thing. So that's where using the hammer tube with the amplifier, the Jackhammer Amplifier under the bed might be a good thing to do. Can you tell me what supplements are antioxidants besides my greens first drink? So the greens first drink, yeah, there's some antioxidants in there. I would not classify that as an antioxidant to stop taking for the 48 hours during chemo. I would keep taking that. The only thing that I would stop taking during the 48 hours, I certainly wouldn't do any vitamin C, either oral or IV vitamin C. I wouldn't do that. I wouldn't do alpha-lipoic acid. I wouldn't do glutathione. Those are the really three main things. Curcumin is an antioxidant. Maybe you want to stop that. I would not stop the green drink. So I'd say curcumin, alpha-lipoic acid, um, and um, glutathione. Those are the three main things that I'd stop, because those are the more powerful antioxidants. I mean, you're eating food that's got antioxidants. It's not that you're like trying to eliminate all antioxidants. You're just trying to eliminate like really high dose things that would negate some of the chemo. A lot of alternative doctors don't even suggest that. They say that you should load up on antioxidants while you're even for those 48 hours. They say you should. They just don't stop people from doing it. I think contrary to that, I think just give it 48 hours off of that. You can certainly fast all your supplements for those 48 hours if you want, but your other cells do need nutrition too. I certainly wouldn't stop the green drink. My last blood work was done in the middle of March. I believe that you recommended blood work every 3 months. I'm a little past that, I'm afraid. I'm wondering what exactly you'd recommend. I have checked this time. Last lab continued to show slightly lower cholesterol, but still in the high range. Do I need to recheck that? We're not really doing a lot for your cholesterol issue. We're concentrating on your cancer, but certainly it doesn't cost really any more to get that rechecked. So getting a lipid panel would be a smart thing to do. Nothing seems to bring that down significantly because we're not really trying to bring that down. On a side note, I could easily feel the tumor in my right breast. That Mayo wanted biopsy. Not sure if it's bigger. Certainly it's not smaller, though. I'm thinking that tumor tests would, but which ones? So we have a female tumor panel. That would be the one to do, the female tumor marker panel. Is there anything else in particular? Certainly a CBC and certainly a complete metabolic panel. Cheek swab, yes, but let's wait till after the blood test. Blood pressure continues to run high, anywhere from 171 to over 74. The lowest has been 127 over 65. Yeah, that's where we want it to stay. Let's get it to stay there. I have not had a wellness physical in going on 2 years because they will put me on blood pressure medication. I don't want to do that. They also push for tests like mammograms I don't want to do, bone density I don't want to do. So yeah, let's just get that blood work done. It's if you do our complete wellness panel, that also has thyroid tests in it. That's always good to look at that too. Is it safe to do your parasite program with kids? I know digestive enzymes and SBI Protector are okay for them, but what about proverbifuge or the paratocin or the pyloracil? All of those are safe with kids. You just have to dose them based upon their weight. So let's say, it says the adult dosage is pretend 3 times a day on something. So if you figure an adult is about 150 pounds, if you have a child that's 50 pounds, you only want to give them one a day. So just dose it down for their size. Those are fine with kids. Of course, it depends on what age kid. If you got a 2-year-old, I wouldn't do that at all. But if you have like a 5, 6, 7, 8-year-old, certainly you can do that. Absolutely. Could you recommend a good, clean, gluten-free sourdough bread recipe? No, I'd recommend maybe going on Instagram looking for a gluten-free bread group. I don't know. You could Google it. You could look up on YouTube. I don't know. Which binders and gums should be avoided? Um, so, um, yeah, you're talking about dietary binders in like prepared foods and things. Not sure the question that you're talking about. If you're talking about binders and gums that are in supplement products, there's really none that really should be necessarily avoided with chemo or anything like that. And this person who asked this question, I'm going to give them a list of what to take for starting chemo. Does a daily order or detoxing protocols matter? That's a good question. I exercise, I do lymph massage, I do rebounding, I do sauna, I do coffee enemas. Is there an issue with what order you do them in? I don't, just whatever order makes sense for you and your lifestyle. Yeah, does it make sense to be exercising and then go in a sauna? Maybe that doesn't make sense because you're burning off a lot of minerals and then you're going in a sauna. So it's kind of doing similar things, exercise and sauna. Is doing a coffee enema and then doing a castor oil pack, right after that, a good thing to do? I don't know, it kind of, you're doing similar things there. So breaking them up, you just kind of got to think through some things. I don't think there's any perfect order for anybody or anything of these, so it's just would be just try to use your common sense on those things. I've been using castor oil packs on my neck and liver overnight. Is this a good thing or is it too long? Typically, we recommend castor oil packs doing that like 30 minutes, doing it overnight. I know people have done it. We've had people, maybe on this call that have done it, or this video, not on a call. But, if you're not having ill effects of it, I don't think there's a problem with it. Watching your videos on chemo, you suggest to run the Rife immediately after an infusion, but we live an hour and a half from the hospital. If they would allow my Rife in the infusion room, would it be a good idea to run it during the infusion? Yes, it would. I don't know if they will allow it. And certainly just go home and run it. Don't worry about the hour and a half ride. I've had people hook up the Rife in their car. Had a realtor once had really bad breast cancer, and she just refused to stop working. She said she's in her car constantly. She hooked up the Rife in her car and ran it in her car all the time. That was interesting. But typically, you just go home and run the Rife. That's what 99% of the people do. I've been getting canker sores on my tongue. They're irritating sore. What are they from? What can I do to heal them? L-lysine, it's an amino acid, can be helpful for canker sores. Also, taking calcium lactate and putting them directly on the canker sores have been known to help. Canker sores are from a change in pH in your mouth. That's what they're from. Well, canker sores are from herpes simplex virus that lives in the nerve ganglion, in the trigeminal nerve ganglion up by your cheek. So that herpes virus lives there and it comes out when there's a change in pH in your mouth. So that's why people get a cold sore after they suck on a lemon. They'll get a cold sore because it changes the pH. It's a drastic change in pH in their mouth. So whenever you have a drastic change in pH in your mouth, a cold sore can come out. That's why people could go months or even years without a cold sore. Then all of a sudden they get a cold sore when they eat something really super spicy, or they have some lemon juice, or they drink something that would acidic or alkaline that could throw off the pH in the mouth, and that just gives the opportunity. So herpes simplex is an opportunistic organism, and it comes right down the trigeminal nerve and forms a blister in the mouth. That's what it is. So L-lysine can be helpful. You could probably Google a bunch of other different natural things that can be helpful with it too. Years ago, not knowing better, I let a dentist take out all my mercury fillings. He did so just by drilling them all out. I assume this person's saying that didn't use a mercury vapor vacuum, didn't use a rubber dam to close off your nasal cavity. Yeah, I know firsthand the issues with that. Also, I still have 2 crowns that are covered in white but show silver due to my receding gum line. Yeah, this is a problem. A lot of people have silver fillings underneath a crown, and they don't even know it. Until recently, I used to do oil pulling daily, not knowing I shouldn't if I have silver in my mouth. Also, I was fully vaccinated as a child and young adult. Might metal toxicity be a contributing factor to cancer as well as other health factors? Well, absolutely. Metal, mercury has an aluminum in vaccines and things, and stuff that they're spraying in the air is causing all sorts of health issues. It's a huge, huge, huge problem. And the difficult thing is that you can't really do, chelation therapy or try to chelate this out of your body when you have such large quantities still lodged in your teeth. I've had people that want to get their mercury fillings out, but they have so many, literally, they'd have to get every tooth in their mouth pulled. It's just impossible task. You just got to learn to fight what giants that you can fight without opening up battles that you're not able to defeat. So if that's a mixed metaphor, I apologize. I sent 2 emails with photos of rashes and welts. Were you able to see those? Yes, I was. Like I said before, it's very difficult to determine the cause of a rash sometimes. Well, yeah, it's easy when you go out and you rub against poison ivy and you get a rash. So that is a topical dermatitis where there is a rash because of a topical irritant. But when there is a systemic irritant that's causing a dermatitis of some kind, it's difficult to find out what that is, because even if you took a sample of the pus of a rash or you took some sort of microscopic sample from the rash, you're still not going to see anything most of the time in the rash itself, because the rash itself is a histamine inflammatory reaction due to some irritant. Well, the irritant isn't necessarily present in the rash itself. So it's hard to analyze, the cause of that rash sometimes. Anything that can cause inflammation that can cause a rash. Anything that can be an irritant can cause a rash. So you have to do some digging into what could be an irritant in that person's case. And that's not always an easy thing to figure out. Would orthospores be a good thing to take during these upcoming weeks of chemo? What about liver ND? So I told this person, we just had a call, and I'm gonna do a workup for them on what they should be taking for their chemo. All right, sorry about not being able to take live calls today. Hope we'll be back online and regular and next week, Lord willing, and we'll go from there. All right, bye-bye.